I've been on Copaxone now for like 5 months, and as far as medications go, it's going okay. It's doing its job. I haven't really had any relapses except for like a quick little blip with my shoulder, which was relatively uncomfortable, but it's fine. I have been doing well on it, I think. I have a MRI coming up, so I guess we'll see then how well I've been doing on Copaxone, but I think everything has been going well. However, I'm experiencing side effects. These side effects are things like itching, lumps under my skin, welts, redness, burning sensations, and there's like a black band that develops over my injection sites across my thighs in the shower. It's not pretty. I don't really like that. And so, having voiced my concerns to my doctor, he suggested switching to Mavenclad. Mavenclad is a form of chemotherapy that works by killing B and T cells so that your body replaces them and forms new cells which are less damaging to your body on the whole. The problem with this is it comes with a risk. That risk is your lymphocytes may not come back to what they were prior to receiving treatment. You're going to be more susceptible to infections, viruses during the time when your lymphocytes are lower levels, because it is basically killing off your immune system. Not entirely, but it's causing some damage to your immune system so that your body will rebuild it and hopefully create newer, healthy cells that are not damaging to the myelin sheaths around your nerves. The problem with Copaxone that I'm having, aside from the side effects, is ease of use. I have to come home from work and then pull it out of the fridge and let it sit for 20 to 30 minutes before I can take it. It has to come to room temperature. I tend to take Copaxone at night because I just find it easier to take it then. My anxiety doesn't have time to play with me if I take it and then go to bed. When I first started it, I would have a lot of trouble with my anxiety. I've learned since then kind of what the expectation is, how my body is going to react, and that it's safe for me to go to bed. I will wake up in the morning. My problem with switching medication is that I don't know how my body's going to react. I know that there's increased risk of cancers with Mavenclad. There is risk of liver damage. There is risk of tuberculosis, shingles, a rare brain disease called PML. There's risks. But the reward, is it better? Like, that's what I'm trying to figure out right now. I'm really in a place where I want to make the right decision for me and to ensure that my disease doesn't progress to a form of disability that I'm not comfortable living with. It may progress to that point anyways, but if I can prevent it, why not? The way you take Mavenclad is very simple. For 5 days, you're going to take a course of pills. A month later, for 5 days, you're going to take another course of pills. And then you're done for a year. Year 2 comes around, you're going to repeat that process. You're going to take your 5 days worth of pills, wait a month, take another 5 days worth of pills, and then you're done. And that's it. With Mavenclad, there will be a series of blood tests done. These tests will be looking for any infections that are active in your body. They'll be looking for just anything that could potentially get stirred up by having less lymphocytes actively protecting you. There is a potential need for antibiotics while taking the medications, just as like a precaution to protect you from any infections or whatever that might flare up, or if your lymphocytes dip down too low, then you might have to take the antibiotics just to protect yourself. The other thing that's kind of a con is that for the duration of time where you're taking those pills, you are going to feel like crap. Again, it's a form of chemotherapy. So you're going to feel like crap for those 10 days. But the reward is that you have 355 days where you may not feel like crap. And that's going to last for 2 years after the initial 2-year course. So that's 4 years total, where perhaps you don't have to be on any medications at all. With Copaxone, I don't feel comfortable coming home from work and having a glass of wine. With Mavenclad, I would be able to do that because a week after you ingest these pills, the active medicinal ingredients are out of your system. So 12 days, and then you can have a glass of wine without worrying. Maybe that's not a worry for other people, but for me, like, I just really get freaked out mixing any sort of medications with, I won't even take a multivitamin and have a glass of wine. So like, I'm a little ridiculous maybe, but that's something that I could look forward to, is that I could, if I take the Mavenclad, then I can come home from work, have a glass of wine, and just kind of wind down for the evening. I wouldn't even have to think twice about it. Like, I could just do it. In theory, it sounds like an easy choice. It feels like it should be an easy choice. And yesterday, I was all in. I was like, let's do this. I want Mavenclad. Let's go. But the risks of, like, cancer and liver function problems, it's a really big decision to make, because I have to just take on and accept these risks, and I don't know if I do. I've tried looking into Mavenclad more, but the more I read about it, the more torn in my decision I feel, because I'm just coming up with more mixed messages, I guess. The forms of cancer that were coming up with Mavenclad were all varieties of types. There was blood cancers, lung cancers, like just all the different cancers, a lot of them. And the theory is that because you're killing off the cells and then your body has to replace the cells, it's that regeneration of new cells that is creating cancer cells. And I don't want to do that. I need anybody watching this video to understand that this is all just from my perspective, and I might be entirely misinformed. I am still learning. I'm still new to this. My appointment was on Friday. It's now Monday. I need you to know that this is not me educating you on why you should be taking or not taking Mavenclad or Copaxone or any other future drug that I may or may not talk about. You have to make that decision for yourself, because all of us are on very different journeys, and this one is mine. And this vlog is meant to be just that. This is just me, Dear Diary, out into the world. So I appreciate you following along, and I'll update you when I make my decision. But I think for now, I still have 2 boxes of Copaxone in the fridge. So I'm going to continue taking that and continue talking about Mavenclad to my friends, my family, myself, and see how I feel in a few weeks, I think. It just sounds like such a good deal, you know? Like, it sounds too good to be true. Like, what There's no way to know what the real risk to me would be unless I do it. What would you do?